10:30 a.m. 16th January. It's a date that will go down in history. After 11 months of sickness, death and anxiety, India will finally start arming its citizens against an enemy that has changed the world as we knew it. On day one of the vaccination drive, the largest India has ever carried out, 3 lakh healthcare workers will be given the jab. Who will get the jab first? We'll have to wait and watch for that. But the mere scale of this exercise is a study in itself. A full debrief on the vaccination process and how long it will take is coming up over the next 30 minutes. We are looking at how the vaccination is playing out in other countries and why it has been particularly disastrous in the United States of America. Another important thing to watch out on the show. Who is liable if vaccination evokes an adverse reaction in someone? We are getting you all of that, but we are starting with what tomorrow is going to look like.
3 lakh vaccinations in just one day across 3,006 vaccination sites with 2 lakh vaccinators and 3.7 lakh team members. It's a mammoth rollout of the biggest immunization drive that India and the world has ever seen. Starting 10:30 a.m. on the 16th, the Prime Minister will virtually fire the first shot in India's COVID fight. All 3,006 centers will be virtually connected during the launch. 100 people will be vaccinated at each center every day.
दुनिया का सबसे बड़ा कोविड का वैक्सीनेशन प्रोग्राम, उसकी शुरुआत भारत में हो रही है. हमारी पूरी तरह से संपूर्ण तैयारियां हैं सारे देश में.
1 crore healthcare workers and 2 crore frontline workers will get a shot in the first phase. The complete procurement of 1.65 crore doses of Covishield and Covaxin has been flown to all states. The Health Ministry has sent a rule book to all states with details of dosage, handling, storage and precautions. The vaccination is only for those over the age of 18. Pregnant and lactating women can't be vaccinated. They haven't been part of any trials. Caution is advised for those with a history of bleeding or clotting disorders. Recipients will get either Covishield or Covaxin for both doses. The vaccines are not interchangeable. There will be an interval of 28 days between doses. Vaccine recipients will get an SMS with the date, time and location for the shot. At the vaccination center, names will be tallied against a database before the shot is given. Recipients will have to sit in an observation room for 30 minutes after the jab to monitor for any reaction. An electronic certificate will be sent to each recipient after the shot. All this will be done through the CoWIN platform, which will also be launched on Friday. 1075 is the dedicated hotline set up to address all queries related to the rollout and the software. There's a strict protocol for those who have contracted the virus. Vaccination will be deferred by 4 to 8 weeks after recovery of those with active COVID symptoms, those who have been given plasma therapy, and patients who are unwell and hospitalized for any other illness. Vaccine recipients could experience pain at the injection site, headache, body ache, fever, chills, fatigue and nausea. They're mild reactions and nothing to worry about. The number of vaccination centers will slowly be ramped up to 5,000. 27 crore senior citizens above the age of 50 and younger higher-risk individuals will follow the frontline workers. India has a long history of successful immunization campaigns and will rely on this expertise. A year from the first COVID case in the country, the fight is finally on. Deepika Kaura, CNN News 18.
An army of inoculators across the country is ready, armed with their syringes, and a battalion of journalists is ready as well, armed with their cameras and mics to capture that historic moment. CNN News 18's reporters will be reporting live through the day. Ahead of that, they were at the inoculation centers and are showing us what the process will look like.
Where a beneficiary's details will be physically verified by an officer. Now from here, the beneficiary will be entering room number 2, which is the vaccination room. Now, as we enter the room, there will be a second round of verification. Here, digital verification on the CoWIN software. In fact, the beneficiary's PAN and Aadhaar card details will be sought and his details will be checked on the CoWIN software. Now from here, the beneficiary will be taken to receive the vaccination jab, and this is what the preparation or this is what the setup looks like. So beneficiary will be made to sit there. Covishield will be given on the 30 healthcare workers who will be taking the vaccine jab.
This is the waiting area, and this is the vaccination room where the beneficiaries will move. Now, of course, this is the particular area where the beneficiaries will move as per the second stage of the inoculation program. Now, this is where the health beneficiaries, the healthcare workers, will be given a jab of the vaccine. Now, this is where the entry will take place as per the CoWIN application. So, signages have already been put up here. Now, this is where the vaccinator officer 3 will be deputed. This is the registration desk and the vaccination room. Now, here the registration process will be completed and vaccine will be given to the beneficiaries. Post this second stage is the observation area. Now, this is the observation room, as you can see, where the beneficiaries will be allowed to wait for a period of 30 minutes or more to check for the eruption of side effects.
All is set for the big day tomorrow. A list of 100 beneficiaries is ready. In fact, doctors, nursing staff, security guards were just getting counselled by the nodal officer here. Dr. Nakul, you're going to be one of the first people who will be getting vaccinated tomorrow. Nervous?
Just a little bit, yeah, tad. I mean, I think everybody, it's normal that, everyone should feel a little apprehensive, but it's not something that I'm overly concerned about because I'm very confident with, the research that has gone through.
And we need to be confident about what our scientists are giving us as well. Now, if there is one thing all of you have been constantly Googling about, it is the CoWIN app, the digital platform which will control and monitor the vaccination drive. So far, ladies and gentlemen, do remember that it is not available for regular Indian citizens like you and me. It's only available for government officials who are involved in this drive. And yet, there are already reports of it crashing. Here is all that you need to know about the CoWIN app and how it will help you get immunized when your turn comes.
It is the gateway to the largest immunization drive in the world. CoWIN, COVID Vaccine Intelligence Network, is the digital platform for the COVID vaccination drive. It will be India's most used internal portal. 3,000 vaccine sites logging on in January itself. CoWIN rides on a system called EVIN, which ensured essential immunization services during the pandemic. Access to the CoWIN platform is limited to central and state government administrators for now. CoWIN allows real-time information on vaccine stocks, storage temperatures, and individual tracking of beneficiaries, automated allocation of vaccination sessions, Aadhaar authentication to prevent malpractice, reporting and tracking of any adverse events after immunization. SMSs will also be sent out in 12 languages to guide beneficiaries and vaccinators. It also provides for DigiLocker integrated for data retrieval and storing QR code-based certificates. Also, a 24/7 helpline. It also provides for a chat box with pattern recognition to help navigate this portal.
बेनिफिशियरी को वैक्सीनेशन हुआ ये भी डिजिटली कैप्चर किया जाएगा और उसको अगला डोज लेने के लिए कब आना है ये इंफॉर्मेशन भी उसको डिजिटली दी जाएगी.
A couple of dry runs have thrown up some kinks in the system that are getting ironed out. The software did not respond well in some areas of the country. In others, broadband and internet issues held up its use. What is important to note is that this particular software is not open for public use just yet. The beneficiaries who are going to be getting the benefit of the government's inoculation program are already registered or are in the process of getting registered. More than 1 crore registrations have happened in the Covin software already. Sources within the government say that it is only going to be open for public use once at least 60% of the immunization program for the healthcare workers and the frontline workers gets completed, and that is expected sometime in the month of March. With video journalist Chintan Devpuri, Sneha Mordani in Delhi for CNN News 18.
Margaret Keenan, a 90-year-old grandmother in the United Kingdom, was the first person in the world to be inoculated. That happened on December 8th. A month on, many other countries have taken the plunge. Let's see how they are faring and what their experiences are showing. First of all, let's start with the success story that Israel is. It has managed to inoculate 23% of its population so far. Their centers are open 24/7. They're doing this at a war footing, as it were. The aim is to inoculate 1.5 lakh people every day, and all people who are above the age of 18 have to register necessarily. That's the success story that is coming from Israel. How's the United Kingdom looking compared to Israel? Not very good. Look at how far they have managed to inoculate, given the fact that they were the first country to start inoculations. 4.3% population so far of the United Kingdom has been inoculated. It is a slow start, but the government is saying we are picking up pace, and there will be a gap of 12 weeks between the doses. So after the first dose is administered, the second dose will be administered 12 weeks later. The United States, terribly sluggish pickup. 0.69% of the population has been inoculated so far, which is next to nothing. Sluggish start. There are many experts in the United States of America, and you'll see that in just a bit in one of our reports. They're calling this a disaster. Different states have different rules. There is absolutely no coordination between the central government and the state governments, and hundreds of doses and vials have been wasted. Now, the aim is ultimately to inoculate some 10 lakh people per day, but that's not happening so far. And all this while, the US is now warning of more surges in the coming weeks. Remember, 4 lakh people have already died in the United States. Denmark, 2% population inoculated so far. They are the first country that is actually considering a vaccine passport. What does that mean? Once you have been inoculated, your passport will say it. What they have done so far in this 2%, what they have done so far is cover all nursing homes, which means their top priority has been doctors and nurses and people who are in nursing homes. Italy is doing it in style. Their pace is not very fast, but the style is still there. They've managed to inoculate 1.3% of their population. What they have is design a vaccine pavilion so that people don't feel like they are coming in a stuffy environment to get inoculated. To take away the anxiety, the government has commissioned designed pavilions, as it were. What we are being told is that of the total dosages that were available to them, 55% of it has already been used. Now, the US, under President Donald Trump, completely mishandled the pandemic. As a result, the richest country in the world suffered the most with 4 lakh deaths and counting. The vaccination program is underway and is being called a disaster by many, given the slow pace. Experts are warning of a fresh surge over the coming weeks. Dr. Anthony Fauci, the top doctor there in the US, is saying that the US could now be seeing, as I said, a surge, and possibly what they will need is 1 million vaccinations a day.
The surge is getting worse.
Until we see hospitalizations drop, and until we start to see a sustained drop in daily cases, we're going to see this terrible toll.
That terrible toll growing by the thousands on a daily basis. More than 3,800 deaths reported just yesterday.
4 to 6 weeks from now, we could be seeing twice as many deaths, or maybe as much as 4 times as many deaths a day.
Hospitalizations hovering around 130,000. Daily new cases now averaging more than 245,000. That's up 10% in the last week. In Los Angeles County, 1 in 3 residents has been infected since the pandemic began. And now officials warn outbreaks are growing. One metric moving in the right direction, testing, up nearly 20% in the last week. Though as sites like Dodger Stadium shift to vaccinations, there's concern testing may take a hit. More Americans are now eligible for the vaccine, 6.6 million in California alone.
I decided to get here early.
But finding that first dose isn't easy.
They all said no.
Especially as the pool grows.
Pharmacies, we called hospitals, we called health departments, doctors' offices, they all just said that they don't have it.
Major league stadiums across the country stepping up to the plate as mass vaccination sites. New York opening its first drive-through facility Thursday morning.
We're only held back at this point by the number of vaccines.
Distribution still a major hurdle.
At the rate we've been on, Chicago won't be fully vaccinated for another year and a half, and that is completely and totally unacceptable.
Mississippi has already exhausted its supply. As issues mount, more states questioning President-elect Biden's pledge to get 100 million shots in arms in his first 100 days.
They're going to need resources.
A third vaccine is on the horizon. Johnson & Johnson could apply for emergency use authorization by the end of the month.
This vaccine would really, I think, open up any bottlenecks that we have in vaccine distribution.
It's not only easier to store. Early data from J&J's initial trials also shows immunity with a single shot.
Having a single dose vaccine will be a game changer.
It will be as and when it comes. Meanwhile, in the United States and UK, if something goes wrong with the vaccination or the vaccine, if there is an adverse reaction, then the liability is with the government. The government pays the damages or the compensation. However, in India, that is not the case. The liability is on the vaccine producer. Sneha Mordani is getting us more details.
COVID vaccine makers in India will be held liable for any complications or adverse effects that arise from the shot. The government has turned down the demand for including an indemnity clause in the purchase agreement that the companies be protected against any liability. An indemnity is a form of insurance for legal claims made by vaccine beneficiaries if there are complications after receiving a dose. The purchase agreements with both Bharat Biotech and Serum Institute say that the companies will be liable if compensation is to be given. Both companies had wanted protection, saying that the urgency and situation under which the vaccine has been developed was unprecedented. CEO of Serum Institute of India, Adar Poonawalla, told Reuters that supplies of the vaccine would be at risk without indemnity for vaccine makers. The company was earlier served with a 5 crore legal notice by a trial participant. Bharat Biotech, however, has been more guarded in its response.
It's not playing a major role in our minds as of yet. That is for the national agencies and the government to take a call. The other countries are following it. So we will continue to do with our work as we go on a daily basis. It's one day at a time for us. So we don't work keeping, whether what is going to come or what is going to happen next. So if we start getting into those areas which are not in our purview, then I think we will not be able to focus on our work, which is under our purview.
Also, vaccine makers have to inform health authorities immediately in case of reports of risk or complications. A highly placed source within the Drugs Regulator's office had told us that granting indemnity was out of question. This when a specific question was asked about Pfizer's talks with the government of India that didn't seem to be materializing because Pfizer seems to be insisting on indemnity. Even then, the regulators had made it clear that they are not keen on granting indemnity either to Pfizer or to any other company developing the vaccine against COVID-19. Medical ethics experts say that this responsibility should have been shared by the government and the company together.
There are multiple stakeholders involved in this decision. It's the government, it's the manufacturer, it's the regulator, and it's the recipient. And I think it's especially important for us at the time of a pandemic when we are using vaccination as a public health response that we ensure that the vaccine recipients feel that they are protected in this regard. And hence it's very important, I think, for the government and the manufacturer to figure out a way that they are able to address this issue.
A number of countries, including the United States of America, the United Kingdom, the European Union and Canada, have shifted part of the liability to the government, considering the urgency to develop the vaccine in a short time span. In New Delhi, Sneha Mordani for CNN News 18.
Now, the COVID vaccination exercise may be the biggest in India's history, but mass vaccination is certainly not new to India. More than 27 million pregnant women and 25 million infants are vaccinated every year under India's universal immunization program. Rajiv Kumar is taking a look at India's immunization program, which has successfully eradicated many dreaded diseases. It is, ladies and gentlemen, on the backbone of this experience that India is confidently going ahead with the COVID vaccination.
Edward Jenner discovered the smallpox vaccine in 1798. 4 years later, it made its appearance in Mumbai and soon extended across the country. By 1968, the smallpox strategy switched to surveillance and rapid containment. In 1971, freeze-dried vaccines were introduced, replacing liquid vials. By 1973, smallpox was restricted to a few pockets and completely eradicated by 1977. In 1948, independent India's first BCG vaccination drive was launched. In 1962, the BCG vaccination became a part of the National Tuberculosis Control Program. The National Immunization Program was launched by the Janata government in 1978. This was modified into the Universal Immunization Program in 1985. One of the largest health programs in the world, it included vaccines against TB, polio, diphtheria, whooping cough, tetanus and measles. India's biggest success story has been the drive against polio. The massive pulse polio immunization program launched in 1995 aimed at 100% immunization in the age group of 0 to 5 with an oral vaccine. Door-to-door coverage and a huge information campaign led to polio being eradicated in 2011. The World Health Organization removed India from the list of active polio endemic countries in 2012. 172 million children are immunized against polio every year. In 2014, the NDA government launched its flagship vaccination program, Mission Indradhanush, aiming to protect children and pregnant women from vaccine-preventable diseases. While some of the redundant vaccines have been replaced, others for hepatitis B, Japanese encephalitis and meningitis have made it to the list. With Rajiv Kumar in New Delhi, Ayushman Jamwal.
On that note, a quick break here on Debrief. Up next, how and when children will be inoculated for COVID. That's up next. Do stay with us. As the COVID vaccination program gets underway in India, a question many parents are asking is this: when and how will my child get inoculated? Well, they won't be in the first or the second phase because no vaccine has been cleared for children or for pregnant women. But Bharat Biotech is holding out some hope. Here is Dr. Krishna Ella talking about trials on children.
Dr. Ella, you know, a lot of people have been asking this question, and I just want you to throw a little more light because yours is a company that is also testing the vaccine on children, and you did it as a part of the phase 2 trials. Just tell us, what is the age criteria and when can we expect data then to see whether this is a vaccine that can be used in children as well, above the age of 12, 14? What is it that you have right now?
In our phase 3 trial, we included 12 and above, Sneha.
Okay.
So what we are now planning to submit a protocol from 2 years to 16 years, we're going to submit a protocol.
Okay.
Because the existing vaccines which are in the marketplace right now, whether US and Europe, they cannot go less than 16 years.
Okay.
They're scared of going on safety issues.
Okay.
So I think we feel strongly that our vaccine can go to 2 years because same platform technology is used in newborn baby, like injectable polio vaccine, whether Japanese encephalitis, which we are using right now in national immunization, all are inactivated same platform technology are given. So we feel strongly it can be given to children.
And of course, you do know that even when the vaccination process begins, you cannot drop that mask. And why can you not drop that mask? Because some degree of protection comes in only after the second dose. A couple of weeks after the second dose is injected, until a large population of our country is not inoculated, it is not safe to do away with the mask. So the mask is going to be with us for the next 6 to 8 months. Thanks very much for watching.